This is Precision, Perspectives on Children's Surgery from Ann and Robert H. Lurie Children's Hospital of Chicago. I'm your host, Erin Spain. On this podcast, we introduce you to surgeons at one of the country's most renowned children's hospitals to find out how they're transforming pediatric medicine. Today, we are celebrating a major achievement at Lurie Children's. The Pediatric Liver Transplantation Program recently completed its 500th liver transplant. This comes 28 years after performing its first one in 1997. As one of the largest and most experienced programs of its kind in the country, the Pediatric Liver Transplantation team consistently has high volumes of patients with successful outcomes. Joining me today with details on this milestone is Dr. Juan Carlos Caicedo, the Division Head of Transplant and Advanced Hepatobiliary Surgery and Surgical Director of the Siragusa Transplantation Center at Lurie Children's. Welcome to the show.
Thank you very much, Erin. It's a pleasure to be with you. Thank you for having me.
Well, this is a very exciting story we're going to be telling today. This big milestone, 500 liver transplants. This is something only a handful of pediatric hospitals around the country have achieved. What does this milestone say about Lurie Children's and the program that was established here in 1997?
Yeah, this is something amazing because a transplantation is a team sport. This is not only one person trying to do it, it's a whole team caring for a child in this case and their families. To be able to do 500 transplant is amazing. And as you said, Erin, very few centers in the nation has achieved this milestone.
And thinking about that, 1997, things were different back then. We know so much more now. Can you just talk about those early days in 1997 and how it's changed over the years?
There's a lot of changes in the sense that was our early field by then. The outcomes are not as good as now. And there's a lot of improvement in surgical techniques. We are offering better access to care to these patients because, for example, here at Lurie Children, we provide all type of liver transplants. It's not only a whole liver transplants, we do partial liver transplants. We take a single organ and divide it in two and transplant two people, or we reduce the size of a liver to allow to fit to the child. We're fancy tailor, we reduce the size of the liver, and that is what we give to the patients. Or we take a piece of liver from somebody alive. And in that way, we're improving access to transplant care for these patients, and they are getting transplanted, and the outcomes are much better. And then even the medical management is better, the immunosuppression is better. Now we're working in minimizing immunosuppression, minimizing the complications associated with that. There's a lot of improvement and innovation that has helped us to improve outcomes in this community.
And here at Lurie Children's, there are some eyewitnesses to this progression. In 1997, there are 3 people that were at that first surgery who are still here today. Tell me about that consistency over the years.
Yeah, no, this is amazing. Then we have to recognize these people. First, let's start with Dr. Ricardo Superina. He's truly a pioneer there in the field of pediatric transplantation, pediatric surgery, portal hypertension surgery. He is a world-renowned pioneer in these fields, and he started the program. But also we have to recognize also our hepatologist, Dr. Stella Alonso. She started with him as well with Peter Whittington, that now he is retired. They start together this program. And now we have achieved this huge milestone. And also surgical tech, Pamela Research. She has been with us and still today. We did surgery with her yesterday.
So we're thinking through all these 500 patients the team has served over the years. How life-changing is this operation for these patients? You know better than anybody how this can change lives. Can you just tell me about the impact that this surgery has on people?
Yeah, the impact is huge. We can analyze different aspects. One is about the kit for the patient itself. For them, they were very sick usually before the transplant. And without transplant, most likely they will die. They are critical ill, they are not growing, they are malnourished, they are very weak and frail, and they are not enjoying life. And if that's happened to the kid or the baby, the family is suffering too. But with the liver transplant, they have this new option of life. And then with the transplant, now they can start, the color change. Now they are no itching no longer. They start eating again. They are able to grow and they were able to even walk. Some of them they were able to walk and now they can walk, they can go to school. And now with 30 years, we have patients that they have gone to college, they have get married, they are now having a normal life after transplantation. Then the liver transplant transformed not only the kid, but also transformed their families. They were suffering. They didn't have even hope for a future. But now with the transplant, they're enjoying that present and their future.
You talk about just how sick some of these children are and that they need a liver transplant to survive. Can you explain some of the conditions that lead to liver failure and the need for liver transplant?
There is a spectrum of diseases. The most common cause is when there's a biliary atresia. What that means, the biliary system is not developed. The bile cannot drain, and that damages the liver over time. And this kid become very sick. That is the most common cause. But there's also other type of causes, like metabolic diseases, that can affect the liver too, right? There's a genetic causes that also end up as a liver failure. And sometimes there's a acute diseases. Sometimes there's an infections or sometimes there's fulminant hepatic failure. In bigger kids, if they're taking Tylenol by accident or something, they can develop acute liver failure. And many of them, if they don't improve spontaneously or with medical treatment, the only option for them is transplantation.
The great news is today, liver transplantation in children is a highly successful therapy. Tell me about the outcomes of your patients.
Yeah, absolutely. The outcome has improved dramatically over the years. And here at Lurie Children, as we have a very comprehensive team, very experienced team, then we have been able to improve the outcome dramatically. We're in the top tier of outcomes 1 year, 3 years. And we are seeing survivals over 95% of 1 year. When without transplant, the death was very certain, right? Then if we're talking that most of the patient may die without a liver transplant, we're transplanting, we're getting survivals about 90, 95. It's fantastic.
One of the reasons this program has been so successful is because it's one of the only pediatric programs in the country that can perform split liver and partial liver transplantation. Now, you mentioned this already. It's really an incredible procedure and has benefited your patients and adult patients at the same time. Can you explain this in more detail to me?
Yeah, absolutely. Then, first of all, human beings, we have only one liver, but the liver is the only organ that can regenerate. We can remove up to 70% of our liver if we're alive. And if the liver is healthy, we can remove 70% of the liver without problem. And we can use that to transplant somebody else. Usually it's an adult recipient. But just to say the liver regenerate. For a small baby, sometimes we just need 25% of the liver. Or if it's a bigger kid, maybe it's the left lobe, is 40% of the liver. Then that's why, for example, we can take a single organ from a deceased donor, we can divide it in two and transplant two people. Most of the time, we're transplanting a child as well as an adult. But here at Lurie Children's, because our team, because our experience, we're one of the few in the nation and in the world that can do an interinstitutional split liver transplant. That means that we transplant a small baby and a bigger kid in the same institution in Lurie Children. We have done that multiple times. That is remarkable. Then we're saving two patients with a single liver. The other option is if the liver is too big for that recipient, but it's too small to transplant two patients, then what we can do, like a fancy tailors, if the liver is too big and the recipient is smaller, we can just reduce the size of that liver to make it smaller, and in that way we can transplant that kid. That is called reduced size liver transplant. And the other option is taking a partial graft from somebody alive, a family member, the parents, the brothers, uncles, or somebody from the church, or somebody that doesn't know the kid, that heard about the kid need and they offer to donate the liver, is a non-direct donor, and they can help save the life of the kid with this donation. That is something that we do here at Lurie Children's. The living donation, we partner with Northwestern Memorial Hospital. Our surgeons work there as well here at Lurie Children's, and we are able to do that. The adult donor happened in Northwestern Memorial Hospital. The transplant for the kid happened here in Lurie Children's.
For people who don't know, talk about that proximity with Northwestern Medicine and Lurie Children's and how that benefits both institutions and patients, adult and pediatric patients.
As I said before, transplantation is a team sport. It's not only one person doing it. And then that is a limitation in other centers in the country and in the world. The problem is that they're isolated. To do these complex procedures, you need to have a lot of experience and a big teams. And you have to combine. For example, if it's a living donor, they're adults. And the transplant or the donation won't happen in the pediatric hospital, will happen in the adult hospital. But because we are integrated, the transplant programs, then we work together and then we will do the donor, the parents or the family member or somebody that just move forward, non-direct donor or altruistic donors, the surgery, the evaluation, the donor evaluation, as well the surgery happen in Northwestern Memorial Hospital. There is just basically is a building connected to Lurie Children. This is another building for people that don't know downtown Chicago, but basically they are connected. It's one block away, but they are connected through bridges. Then people don't need to go out of the hospital if they want to go from Lurie Children's to Northwestern Memorial Hospital. They just walk through bridges, and it's just less than a block. And then the donor operation happened there, and then we transport the graft to Lurie Children's where the transplant happens.
Another exciting aspect of the program is that Lurie Children's is able to serve a lot of different people from all different walks of life. You mentioned different countries, from people around the world. You're the director of the Hispanic Transplant Program, which you also founded. Tell me about this program and how it helps Lurie Children's reach more patients in need of transplants.
After I complete my fellowship, here at Northwestern. I started as a faculty, and then I thought that I should serve our population. And that was a big need. Here in Chicago, one third of our population are Hispanic, one third is African American, one third is white. And there was no specific programs in the nation to help them. There was a lot of barriers for them. One big barrier is just the language. I remember one of our patients told us before we started the program that he called 9 transplant programs. And as they answered in English, even though he has a private insurance, he hung up. There's a lot of people think that the problem is the insurance. Sometimes the insurance is not the issue. The problem is even the language. And then just having a program that is bilingual, meaning that not only we speak the English, but also we can speak the Spanish, as well. We are culturally competent, meaning that we understand patients' culture. That is essential to help to change the perception, the misconception that they may have about organ donation, about organ transplantation. We started a program. I started by myself. Now we have more than 60 people that are bilingual, bicultural at Northwestern Memorial Hospital. And then we have transplanted more than 1,500 patients. And we improve access to transplant care to this community, the Hispanic community, by 91%, without affecting the access to any other group. We didn't affect the access to whites or African Americans or the other. We just improved the access of this underserved community. And we were able to increase, for example, the number of kidney transplants in this community by 74%. We decreased the disparity between Hispanics and whites, and it is very well known. There's a huge disparities in these underserved communities, but we're able to reduce the disparity by 70%. That was for kidney. For liver transplantation, also we improve access to transplant care for the Hispanic community by 68%. We increase the number of living donor liver transplant by 80%. That is kind of amazing. Of course, this is small numbers, but again, it's the trend. And now we have helped a lot of centers across the country to develop these type of programs. Now here at Lurie Children's, we are fortunate to have multiple members of our team, for example, the kidney program, that are bilingual, bicultural. They were offering this type of service for our Hispanic community. And again, removing cultural language barriers help a lot. And sometimes that is the issue. The surgery The immunosuppression and everything else is kind of similar, right? We customize, but actually, sometimes the problem is just the communication. And we remove that barrier that is very helpful. We have created other programs also to help other underserved communities. And we were the first in the nation developing this program.
You mentioned that transplantation is a team sport and the families, as well as the patients, they're part of that team too. Can you talk a little bit about that relationship that you have with the families and patients and how by offering more access, how that can help the program be so successful?
It is essential. I mean, this is not only about the patient, it's the whole family. And especially when the patients are so sick, the whole family is suffering. It's affecting them at so many levels. It's affecting how they can work, they can perform their regular life. Everything is shut down when the kid is sick. Then, but working with them is essential because also that will help the kid later on, right? If they are well informed, they will help the kid when they become teenagers to make sure that they don't stop taking the medication, that they have rejection, they can lose the graft. That is very common cause of losing the graft over time. But again, develop the relation with them, the follow-ups, and doing the transition of care. And actually, you were asking before, what is the advantage to have the relation, for example, with Northwestern? Now we are transitioning these patients that were transplanted as a baby, we're transitioning the care to the adult program as because we are integrated, we collaborate, then we can do that transition easier that many programs in the country. They don't have that relation with the adult program. And it's because we are part of that program also, we can help the transition of this patient. Then that can give peace of mind to our patient. This is not only dealing with the problem when they were babies, but then whenever they grew up and they have to do the transition as adults, they know that there's some support and we can provide that support. We guide them through the whole life, basically. Your patients, when they get the transplant, they can return to the primary doctors or the pediatrician. But for the transplant care, usually is done here at Lurie Children's. And eventually, when the transition is done, because they are teenagers or adults, now they go to the adult hospital. That is also very important. That help with the outcomes over time.
And you've described how this program has really grown and blossomed since 1997, and the outcomes are so great now. But what do you think about the future of pediatric liver transplantation?
Well, I'm an optimistic guy, and we see it. The future is bright because we are working not only doing the transplant, we're doing research, we're doing innovation, we're educating the new generation of transplant providers, the surgeons, the hepatologists, the nephrologists. We're focusing improve access to care for patients or group communities that are underserved, but also some patients are coming from around the world that we're talking about from the Middle East, we're talking about from Latin America, we're getting patients from Israel and Canada too, and Mexico. And what a better place than Lurie Children's here in Chicago. A great city with a beautiful hospital, downtown Chicago, with a great airport. Then it's easy to fly to Chicago to receive the best treatment possible. And most importantly, to receive hope when the hope was lost.
For those families who are coming to Lurie Children's or considering coming to Lurie Children's for a transplant, what message would you like to leave them with today?
They should know that here at Lurie Children's, we have a multidisciplinary team that will take care of when they are in that situation, when there's no hope, this multidisciplinary team that will help them to regain the hope. And they will figure out ways to do it. I mean, now we have a combined heart liver transplant program. We are doing intestinal transplant, multivessel transplant. We're combining liver and intestinal transplant. When there's a big tumors that other institutions consider is they cannot be resected, we have different ways to figure out how we can make resectable these patients that were not resectable. And a lot of patients that were not transplantable, we make them transplantable. It is well known that the outcomes improve when there's more experience, when they're a higher volume. Last year at Lurie Children's, we're number one in the nation doing kidney transplants. We're number three in the nation doing abdominal transplants overall. Then we're talking about a kidney transplant, liver transplant, intestinal transplant. When we combine, we're number 3 in the nation. But this institution, the experience goes beyond even pediatrics. In adults, we are doing 400 kidney transplants. We're doing 150 liver transplants per year, and we have done close to 7,000 kidney transplants in adults, and livers close to 3,000. Then there's a team that has a lot of experience overall, right? And specifically in pediatric transplantation is one of the teams with the largest experience in US.
Congratulations again on this incredible milestone, the Pediatric Liver Transplantation Program here at Lurie Children's completing its 500th liver transplant.
Thank you so much.
For more information, including how to make a referral or an appointment, visit luriechildrens.org.